anxious because I know how much I have to do the next day.
What Tara didn't know is that over-the-counter sleep aids typically contain antihistamines that can make you sleepy. And while they may claim to be non-habit forming, sleep specialist Dr. Richard Castriotta says you can become psychologically hooked on them.
It's not addictive like opioids, but it is addictive in the sense that people rely on them to be able to sleep. And then once they start taking them, it's very difficult to sleep well without it.
Castriotta says a lot of the insomnia patients he sees at the Sleep Disorders Center have had a life event that keeps them from sleeping. He recommends counseling instead of over-the-counter aids that will eventually stop working.
Usually what happens is if you're sleeping poorly, you take one of these drugs and you sleep a little bit better, and then gradually you start sleeping just as poorly again. Then when you stop it, you sleep even less well. And it takes a while to come back again.
Still, a Consumer Reports national survey found 20% of people have taken over-the-counter sleep medications just within a year. Most concerning, 41% say they took them for a year or longer. A study from the American Medical Association found frequent long-term use of OTC sleep meds is linked to an increased risk for dementia. But at the time of their approval as over-the-counter sleep aids, there wasn't enough evidence to show that the drugs caused any dependence, so that label non-habit forming still remains. The FDA says using a sleep aid for 2 weeks or less at the labeled dose makes it, quote, very unlikely that the consumer will become dependent on it. However, if your insomnia persists, Dr. Castriotta says, seek help to get over the hump.
The goal is to do this without medications, without drugs, to put yourself in control of this.
All right, now if you